Good afternoon and welcome to Lights, Camera, Clicks. I'm Mike Jennings, your host today, and I'm an account manager here at Ad House Advertising and Ad House Productions. And I have Dr. Chris Plaman with me today from Precision Medical Hair Restoration and Aesthetics. Welcome.
Thank you. Thank you for having me.
Yeah. Say hi to everybody.
Hello, everybody.
All right. So what can you tell us a little bit about yourself and about Precision
Sure.
Hair Restoration?
Absolutely. So I grew up in Albuquerque, so I'm a local New Mexican. Spent the majority of my life here in New Mexico. Went to undergrad medical school at UNM, so I have a lot of years of UNM Lobo loyalty.
Nice.
After medical school, I ended up going to California. I kind of had diverse interests in medicine and stumbled on the field of hair restoration during my time out in San Diego. From my very first day working in the field of hair restoration, I fell in love with it immediately. I saw a tremendous amount of improvement in patients' lives in various aspects. It was something I had never really encountered before, and seeing patients coming back 6 months or a year after their program, their lives had transformed in a positive way, and they seemed like they finally recognized themselves in the mirror again. And seeing how much it impacted people, I was inspired and decided this is exactly what I want to spend the rest of my life, career doing. So I worked in various local surgery offices in the San Diego area. And then from there, after getting comfortability in the field and doing internships with the International Hair Surgery, International Society of Hair Surgery, I ended up deciding to open my office back in Albuquerque, where I'm from originally, to offer this service here in New Mexico.
Nice. So where's your office located?
The office is located 5111 San Mateo Boulevard. So if you're familiar with Albuquerque, it's close to the Cliffs Amusement Park.
Okay. Is it appointment only, or do you take walk-ins?
So we're mostly appointment only, but we're typically able to get people in within a couple weeks. So there isn't a huge wait list for people who are interested in our services. But usually the easiest way to set up an appointment is either online via Google on our website, or just giving our office number a call.
Which is?
It's at 505-557-5500.
Great. All right, so you do hair restoration. I'm sure it's a huge boost on people's confidence.
Mm-hmm.
That's what you're seeing with some of these clients, right?
Yeah, so it makes a really big difference for people. And, we see patients of all different ages, all different backgrounds, both men and women. About half of our patients who come in to see us are female.
Now, are the female patients doing like scalp hair restoration, or what are they doing?
Each case is really case-by-case basis, and it's based off of the extent of the hair loss that someone's experiencing, what are the different causes that's driving that hair loss process, and then also it's dictated by what their goal is. And everyone's different in how aggressive they want to be. A lot of times it can be a medical program to start off. For hair restoration, there's a medical aspect of it, which is hugely important. And that's usually where we like to start. If that's not effective, then we can consider other interventions like a procedure as well.
So when you say medical, are you talking about like supplements, or what do you mean by medical?
Yeah, sure. So for medical, typically it could be prescriptions. You can treat both hair loss, scalp conditions, whatever might be driving it. It can be also how we take care of ourselves internally as well. So we want to make sure that we're optimizing our health. And a lot of times how we take care of ourselves internally is going to be also reflected externally as well. So that is part of the medical realm of hair restoration that's important to address all that low-hanging fruit. But then once we start with tailored specific treatments and prescriptions for hair growth, supplements can also be a part of that. It can be other photobiomodulation or light therapy treatments. It can be scalp injectable treatments to kind of stimulate hair growth. So there's a wide kind of variety of different tools that we have access to.
Nice. So outside of the hair restoration, what other services do you provide?
Yeah, so hair restoration is definitely our bread and butter. That's where a lot of our clinic is oriented and geared towards. But also, we offer other aesthetic services like weight management right now has been very popular just because it's been, with the new medications that have been coming out, it's something that's, we've had a very high success rate for helping patients achieve their weight management goals. So that's been a popular one. Botox and different injectables are very popular as well.
Well, let's talk about the weight management, right? Let's get candid about that. I'm a big guy. I've been big my whole life. And I hear a lot about Ozempic and semaglutide on TV. What can you tell me about semaglutide? Like, what is it, and
Sure.
what does it really do?
Absolutely, great question. So I mean, semaglutide it's the name of a generic form of the medication, and it's in a class of medications called a GLP-1 agonist, which stands for glucagon-like peptide. The brand names are something that people are often familiar with as well. Originally, it became FDA approved under the brand name Ozempic, and that was FDA approved for the indication of type 2 diabetes. Later on, it got the semaglutide under the brand name Wegovy became FDA approved for weight management in adults. So semaglutide is basically mimicking a hormone that is made in our pancreas that does a few things for us. And it regulates our appetite, it slows down how our body's processing nutrients, and it slows gastric emptying. So what that translates into is we typically get less food cravings, so you're not feeling as hungry throughout the day. You know, when you wake up in the morning, the first thing you think about isn't food. The other things it does is because of that delayed gastric emptying, we end up getting full much easier. So portion sizes are reduced. And with the slower gut motility, that keeps us full for longer as well. So we end up having a larger interval in between those meals. That caloric deficit usually translates into a very nice secondary benefit, which is that weight loss that we're usually looking for.
Nice. I'm an emotional eater, right? So I stand in front of the refrigerator, scope it out, pick a favorite.
Yep.
How would that affect me? Would it help with that, or?
It's something that you probably wouldn't have the same compulsion to wanting to make those frequent trips to the fridge, even though that's been a historical kind of response for you. It's likely to dampen some of that kind of inherent drive that you seek food to kind of for comfort in that situation.
All the time.
Yeah.
All the time.
Yeah. Or to eat to fall asleep, something like that. It can.
Yeah, that's horrible. I do that all the time too.
Yeah.
And I think that's part of my weight gain.
Yeah.
Is that I eat a large quantity of food right before bed, and then I wake up full, and it's this vicious cycle over and over, and then a mix of no exercise too.
Yeah, exactly. It's what I tell people is that this is a very helpful tool, but it's not in itself a cure. We always need to be conscientious. This is just something that can help us make the right decisions. So, but it actually to me becomes extra important to be conscientious about your diet if you're using these medications, because overall, the meals are going to be smaller and we're spacing them out. So we're getting less calories, which means that we really have to make those calories count. So we need to make sure that we're getting all of our, quality nutrients into a smaller amount of food, which means we really need to limit all the ultra processed foods and be conscientious about that. The other thing is we want to make sure we're consuming enough protein. The reason that can be important is we want to make sure that we're still keeping our muscle mass, losing the type of weight that's not doing us any favors, that kind of redundant adipose tissue that's not good for our health. That's what we're trying to select for as much as possible. So making sure we're eating enough protein and things like that is also, kind of helpful. But from what I hear from a lot of patients with being on a semaglutide program is just that they're craving those types of food, the ultra processed foods less. And so it's helping them kind of with making the right decisions.
Nice. Well, with that being said, is there like an ideal candidate for this, or does it, will it help everyone in general?
So, I mean, it really has been helping a lot of people from different backgrounds and different types of goals. You have some patients who, are seeking for more robust weight loss, who have higher BMIs or body mass indexes. that want to be more aggressive and do a more prolonged program. And then you have other people who they're looking to lose 15, 20 pounds. They haven't been able to lose it with conventional methods of weight loss, exercise, and there's just a little bit of stubborn weight loss that they're trying to get support on. So it's highly variable, all different scenarios. We customize it for what patients' goals are. But it's generally a very safe medication, but having a physician to actually sit through with patients to make sure they're a good candidate is important. There are certain scenarios where you'd want to be extra careful and conscientious. For example, there's a black box warning that it shouldn't be given to anyone with a history of thyroid cancer or direct family member with thyroid cancer and rare endocrine neoplasia syndromes. If someone has a history of low blood sugar, then that's also something you would want to be, careful about as well. Same thing if someone has had a history of pancreatitis, bowel obstruction. These are things that would make you give pause to this being a great therapy to start off with.
So then it starts with a consultation, medical history, that type of thing.
It's very important, exactly. So the consultation is important for a lot of reasons. Number one, to make sure it's a safe treatment for the individual. Number two, so that the person who's doing it understands what they're taking, why they're taking it, how to approach a treatment plan, how to get the most out of their treatment plan safely, how to limit the downsides and the side effects, and also what expectations, right? I think that it's easy these days because these medications are overwhelmingly popular, are all over the place, right? Every time you click on the web somewhere, you see something about them. And getting patients' expectations in line with how to safely approach the protocol, I think, is important also, because sometimes you can get unrealistic and expectations from reading kind of clickbait articles on some pretty amazing outcomes that can happen, but really just to approach it in a safe way is important.
Is there like a max amount of weight that you can lose on it, or is it infinite?
I haven't personally tested those boundaries, but in the clinical studies where it got its FDA approval in semaglutide, it was a study that had 4,100 patients enrolled in that study, so just over 4,000 patients. It was a 68-week study, so just under a year and a half. And patients who were on the semaglutide program ended up losing an average of 14.9%. Which is almost 15% of their initial starting body weight. So highly effective. So really the max amount of weight depends on a lot of variables and unique circumstances for that patient. So it's going to include how much redundant mass there is to lose to begin with. What's the dose? What's the timing? And again, we want to make sure that we're selecting more for that unhealthy type of weight, as opposed, if we're losing muscle mass, then that's not necessarily doing us a favor either, right? We want to keep our muscle mass on board because that's going to help us keep the calories off as we're starting to wean and taper down the medication, right? So that muscle has more metabolic activity for us. So that's going to be something that's going to be effective for our long-term health.
Now, I've heard about like Ozempic cheeks or Ozempic face, different. It's been called different things, but I think what it is that you become a little gaunt.
Sure.
Right? I think is the word. And so is that part of that going too far, or what is that exactly?
Yeah, absolutely. I mean, I think that everything in life and in medicine is about maintaining some degree of balance and moderation, and things you can push anything too far to the edge. So one of the manifestations, if you're on a lot of the medication at high doses for a long period of time, and maybe even excessively so, then you can end up with losing, important fat that's important for keeping normal structure, for facial features. And so I think everything in moderation and doing things more so not to lose the most number of pounds on the scale, but how do we achieve the maximum amount of health? What's the healthy weight for us to be at? A lot of my patients who are on semaglutide, they come in, they have high blood sugar history of pre-diabetes or diabetes. Then they'll also have other comorbidities associated like high blood pressure. I've had dozens of patients who, once we're able to get that weight loss down, they've been able to come off or reduce the number of blood pressure medicines that they're on. So what we're seeing is that there's also these other secondary health benefits, not just from the weight loss, but also the comorbidities associated with carrying that extra weight. And that what we call the peripheral insulin resistance seems to be improved with this medication as well.
So, with all that being said, are there side effects to taking it? Like, what are the main side effects that we should be aware of?
Absolutely. Great question, and very important to know before you start any medication. So, the unintended kind of more negative side effects, right? The positive side effects, the weight loss, the food cravings, things like that. The negative side effects are going to be oftentimes related to that GI system as well. So often the most common side effects that I hear are acid reflux and nausea, stomach cramps and bloating, constipation and diarrhea, and headaches. Those are by far the most common. Rare side effects are possible, but not very frequent. But so I would say side effects are pretty common and actually a fairly high percentage of patients. The goal is, how do we maximize the treatment benefit? How do we get it to accomplish our goal of being less hungry, controlling our cravings, being able to manage with smaller portions and feel that fullness with reducing the amount of the unpleasant side effects, right? How do we get the best of both? And sometimes that's a little bit of a moving target and kind of take some titration. And everyone responds to the medication a little bit differently. Some patients are very sensitive to a low dose. Other patients are more resistant and need a higher escalation before they really get that weight loss benefit. So it kind of takes a little bit of teasing out and consultation on kind of figuring out what's the dose. And then oftentimes our body can get a bit acclimated. And so we may have to adjust dosing accordingly. But side effects, I mean, if we're getting a lot of things like acid reflux, nausea, it's telling us either one, it's too high of a dose. Number two, maybe we need to control our portion sizes even more, right? So reducing those portion sizes, eating less spicy foods, maybe before dinner, or sometimes as simple as taking a over-the-counter antacid can help. Another side effect, the constipation, is because the food's moving through the gut slower. So I tell patients it's extremely important to maintain hydration. That's going to, because our gut's reabsorbing more of that water, the hydration is the most important thing we can do. Increase our water intake, supplement with fiber, Metamucil, et cetera, can be helpful as well. Generally, for most patients, those side effects tend to get dampened over time as we've been on it for longer, the same way we get acclimated to the benefit.
Oh, I see where you say it's a tool.
Yep.
Right, yeah. So outside of Ozempic and semaglutide, are there other weight loss drugs that you utilize at the clinic?
Yeah, so a very similar medication that's well known right now is tirzepatide. Tirzepatide, it's a GLP-1 agonist and a GIP agonist. So it's got two incretin hormones that it's mimicking. So it's very similar to semaglutide, has a lot of the same physiology. It's under the brand name Mounjaro for type 2 diabetes, and it's also under the brand name Zepbound for weight management in adults. That medication, the tirzepatide is the generic variety of it. It's actually been found in clinical studies to be slightly more efficacious than even semaglutide. So instead of that 15% initial body weight reduction, there are some studies that suggest that it's up to 19% or 19.5% of weight loss reduction from starting. And there was also just a recent, another study that came out recently that was an aggregate of multiple studies, thousands of patients of data of patients that taking both either semaglutide or tirzepatide in the real world scenarios. And tirzepatide was found to be slightly more efficacious as well. So that's another popular one. Tirzepatide on average tends to be a little bit more expensive, even though it does work well. I have a lot of patients who like to start with the semaglutide, and maybe if they need a little bit of an extra boost or refractory or plateau, then we can kind of transition to tirzepatide. But both of them are good options and to have in the toolkit.
So I've decided to start this regimen, and I've gone through my consultation. What can I expect? Like, what's the treatment regimen usually?
Sure. So most of the times they're given as once a week injectable treatments. There are some compounding pharmacies where the medication can be available in different like sublingual formulas as well. But for most of the time, it's once a week injectable treatments. So what I usually would recommend to patients is kind of start low, go slow, see how the medication, how your body's reacting to it, and listen to your body. And so you start off at a low dose, and you want to stay at that dose for a couple of weeks. They recommend actually 4 weeks at a dose before you increase or escalate. And then sometimes you have to adjust accordingly based off of how you're feeling and responding to it. A lot of patients, they'll notice even from their first treatment that they might notice the benefit, the weight reduction, or the appetite reduction, and the getting full easier. They'll notice it within the first 24, 72 hours.
Wow, that fast. Huh?
For a lot of patients, it's pretty quick acting, and then you kind of get the benefit over the course of the week. Although a lot of patients have told me that they feel like the benefit tends to wear off towards the end of that week. So day 6, day 7, you kind of have to keep your guard up. Otherwise, you might kind of be making those trips to the fridge again. But yeah, so it's something that it's. Once you try it, you kind of know your body, and you have to kind of retrain yourself. What's an appropriate meal size for you? We're so used to ordering these huge portions that now either you're going to be sharing that meal with somebody, or you're going to be getting a to-go box.
Right. So is this something that I'm doing at home, or do I have to come into the clinic to get the injections? How does that usually work?
Sure. So for our program, we offer 2 ways to get the treatment. So the first thing, like we said, is to start off with a consultation, and that'll help us kind of establish which is the best treatment route for the patient. We offer both in-house treatments where patients will come and see us once a week. And then we also offer medications that can be prescribed in vials to the patient, where they can take home either 1 month, 2 months, or 3 months of medication. And I usually always will, go over education on how to inject at home. A lot of patients are, a little bit timid, just not being familiar with needles and having never injected themselves before. But the size of the subcutaneous needle is pretty tiny, and most patients are pleasantly surprised that it's minimal discomfort, if any. So it's, yeah.
So it's a subcutaneous injection, you're saying?
Yeah.
Intramuscular?
Subcutaneous. So tiny little needle. Subcutaneous. Usually probably for most patients, the easiest place to inject at home is usually the belly. It's the largest target, hard to miss.
Yeah.
But then you can also do the soft, squishy part of the arms. You can do thighs as well, and then you can kind of rotate areas as well, so you're not picking on one area too much.
I think on the commercials, most of the time I'm seeing them inject it like in the stomach or on the side.
It is the easiest. If you're self-injecting, that's usually the easiest target zone. Absolutely.
Nice. Well, let's move on to hair replacement, hair restoration. So I know you can't tell, but I have thick, luxurious, curly hair.
Oh, yeah. No, I saw first thing I saw, I was like, this guy's got a great hairline.
Oh, yeah. It's been that way my whole life. There is a spot in the back, though, that's thin. So what are some of the techniques that I could implement to help that hair grow?
Sure. So, the prescriptions that we'll often prescribe, it really depends on in the individual circumstances, but some of the prescriptions are helpful for stimulating more hair growth. So there's only 2 medications that are FDA approved for what we call typical male pattern hair loss, or androgenic alopecia. That's finasteride and then topical minoxidil. A lot of times, even if there's an area that's a little lackluster in hair, if we're able to stimulate the hair surrounding all the neighboring hair to stimulate to grow, then we can often get a little bit of extra compensation in that area, or maybe even a little bit of growth in that territory. If there's a discrete missing little patch, then that might be indicative of a different process called alopecia areata. And so that's more of an autoimmune phenomenon. So if there's discrete little circular patches that are missing that they can kind of coalesce into bigger patches as well, then we're thinking, okay, we probably have to do something more directed against the immune system and kind of dampen that over-exaggerated immune response that might be attacking the hair follicle. So from there, we can use either topical or intralesional injected steroids. We can do different light therapy, injection therapy with PRP. There's also medications that are new immune system regulators that also that are FDA approved now to help treat alopecia areata as well.
You mentioned PRP. So what is that exactly?
Sure. So PRP has been a popular intervention for hair restoration for more than 15 years. PRP, the patient is actually the origin of the treatment. So what we do is we start off by doing a blood draw. We then spin that blood in a centrifuge, extract the layer of plasma that's very rich in platelets, and then with that high concentrated platelet fluid, we do a series of scalp injections throughout the area that we're trying to target more hair growth. Typical protocol is often 3 treatments spaced out 1 month apart. And the rationale for using this rich platelet fluid is that platelets, they're the cells in our body that typically promote the healing and repair process. So whenever there's a source of injury, they're the first responders. They rush to the area, release their contents and growth factors, and promote the healing. So what we're trying to do is we're trying to isolate those properties of those cells and then apply it in a high concentration to an area we're trying to either promote healing or more growth. So that's been a popular treatment intervention for both men and women as well.
Now, the last time I was at your office, I saw that you had like a light cap or something like that. I think it's low-level laser therapy or something. Is that right?
Yeah, low-level laser. So this is another treatment that I've had good success with for both men and women. It kind of looks like it's something from like Star Trek or, something that you wouldn't even suspect to necessarily be effective. But the more research that's gone into low-level laser therapy, the more clinical validation it's had. And statistical improvement we've been seeing in a lot of patients. So basically, we offer both in-office treatments with the therapy, or there's a cap that patients can readily have access to at home, where you can then just use a laser cap and wear it for 10 minutes a night at home. How it works is by improving blood flow, reducing scalp inflammation. We believe it also increases the mitochondrial activity, which is the power factory of our cells. So kind of turning on the keys to the power factory, allowing us to manufacture more hair. I found that it's an extremely effective strategy to use, often in conjunction with other strategies like prescriptions, supplements, etc.
Now, the actual transplantation of hair, I think that's FUE. Is that correct?
Correct.
Do you have people that do like facial hair transplants, or is it just scalp that is mainly transplanted, or how does that work?
It's really dependent on, again, individual circumstances and goals. I would say the most popular reason that we get requested to assist with a hair transplant are typically to fill in the areas that have been lost with your traditional patterned hair loss. So that'll be things like lowering a hairline, restoring shape and density. This is, oftentimes what I'd consider the most important real estate to have hair, first impressions. And then if you can get a really nice looking hairline, a lot of times it, makes things behind it look more full as well. So that's the most popular place that we'll redistribute hair follicles to. A lot of times it might be the crown, which is the rounded portion on the back. Typically what we use as a donor area is the area where we tend to have more genetic resistant or resilient hair follicles, which is for most men the back and the sides. We'll borrow those and then redistribute those into an area that might be lacking in density. We'll have other times where, there's not as robust of a donor supply in the donor bank. So we have to find maybe if there's an alternative location like under the beard, maybe we can borrow some of those hairs, use them as filler in between existing hairs to get even more density if we need to. Other times you'll have patients who they want to actually have beard hair, and maybe they've had kind of the patchy hair, and they're looking to kind of supplement that. And so sometimes we'll actually do a beard transplant where we're planting into the beard region. So, or for females, what we can do is eyebrow restoration.
Oh, really?
So that's been very popular, where we usually borrow hair from the back as well and then implant single hair follicles oriented to the natural exit angle. And then we can help create new shape and density to eyebrows as well.
So when you're going through this process, are you visually inspecting these follicles for the best quality, or how do you decide on which hair follicles to select?
A lot of it even goes into before you're in the operating room, right? Having discussions with patients about first what their goals are and how can those goals be achieved. Mm-hmm. So you want to make sure everyone's a good candidate, right? Because at the end of the day, we have a fixed number of hair follicles, and what we're trying to do is we're trying to utilize those to our best advantage. And so we have a fixed constraint, basically, of what's available. So we have to plan very carefully, how are we going to use those to our best advantage? So with that, that'll help us kind of dictate how many hair follicles are we going to be able to safely and discreetly borrow from that territory, and how many hair follicles is it going to take to achieve adequate or natural density in that area, enough hair to style, for example, and enough hair to blend in naturally with the existing hair. And so it's a very delicate balance, and figuring out, okay, how many can we extract and how many are needed to kind of come up with that number. And then once we have a good idea of how many individual grafts we're going to need to be placing, from there, that'll help us dictate, okay, well, what is the surface area of that donor region that we're able to extract from? And that kind of helps determine, okay, I need to borrow maybe 1 out of every 10 hairs, 1 out of every 12 hairs, just kind of depending and looking with magnification during the procedure. What I try and do is, if there's a lot of hair in an area in the donor region, then I know I can borrow 1 or 2 of those and get away with it. Mm-hmm. What you don't want to do is borrow a hair follicle in a donor it's kind of in a desert by itself, because you know that hair there is maintaining an important function there.
Right. You want to create more problems.
So yeah, you don't want to rob Peter to pay Paul.
Right.
Yeah.
Right. Wow. Honestly, I didn't realize so much went into hair transplantation and, all the different nuanced things.
It's literally splitting hairs. So, yeah.
That's great. So you also mentioned where you have the aesthetic aspect of the business, right? So you mentioned that you do Botox and some other beauty regimens, I think. You want to talk a little bit about the Botox services?
Sure, yeah. So Botox is also another easy victory for people. So pretty much we like to do everything that makes people feel good. Mm-hmm. And so Botox is something that's been very helpful for a lot of patients as well. And very safe treatment, and has a very kind of predictable benefit for patients. Botox we use, it's basically a toxin that helps inhibit the skeletal muscle that's contributing to these dynamic wrinkles, are basically the lines in the forehead and crow's feet that tend to occur as we're doing muscle movements and facial expressions. Mm-hmm. So, it can give a more youthful appearance by getting rid of some of those larger lines and wrinkles.
So is it acting as a filler, or is it having some effect on the muscle underneath?
It's actually inhibiting the contraction at the neuromuscular junction. So it's actually a neurotoxin isolated from a species of bacteria. And so what it's doing is it's preventing skeletal muscle from contracting. So we have different muscles. We have our frontalis muscle, responsible for forehead contraction and wrinkles. We have our procerus muscle here in the glabellar region that's contributing. We have different muscles in the orbit of the eye here that contribute to our crow's feet. So those little radiant lines that can occur here when we smile. So what we're doing is we're basically, that neurotoxin helps dampen that contraction of that muscle, so that way those wrinkles don't develop.
Wow. Now, how does it affect migraines? Because it has a role with migraines as well, right?
Yeah, so for migraines, it's basically reducing the spasticity that can sometimes be associated with migraine headaches. So that's been it has shown benefit in headaches as well. So that's actually, there's two different types of Botox. There's cosmetic Botox, and then there's also medical Botox that you can actually sometimes get covered by insurance for various medical conditions. And refractory headaches is sometimes one of them.
Now, are there any misconceptions about Botox that we can address today?
For Botox, I'd say misconceptions would be, that it looks very artificial. I think that a lot of patients might be scared because, they're worried that it's going to be very detectable. And reality is that you can actually do it very discreetly and give a small amount of treatment to give a nice natural and very kind of subtle benefit for patients without it being very detectable. The other thing is when to get Botox, and that's a different answer for everybody, but a lot of times people think, okay, well, I just have a little bit of wrinkles, so it's not going to help me. I'm going to wait for them to get a lot worse. Reality is oftentimes if we're treating earlier, then we're able to maybe even slow down development of future larger wrinkles even occurring. So there's some preventative aspect potentially as well.
Now, is Botox used for lip plumping as well? Is that what they're doing?
Typically for lip plumping, it would be a type of filler. So typically you're actually injecting filler like Juvederm, for example, to create lip plumping. There can be actually PRP you can use as well, which can be safe for creating a plumping effect and adding volume. Botox can be used for some, kind of around the mouth, and it's very small, very careful increments as well. Although it's a little bit, you have to be very, very careful with it because it can create an asymmetrical smile. So it's not something that I often would recommend for patients.
So when you say asymmetrical, do you mean that it kind of locks in the smile, or what does it do?
If you're paralyzing any of the muscles around the mouth, then there's a potential that all the muscles, there's a very balance between opposing muscle forces in the face. And so if you inhibit one muscle, then you might have an unopposed action of another muscle, and you might lose a little bit of the function of just even a subtle angulation in the corner of the mouth can give an asymmetrical look. And so the Botox is FDA approved for 3 areas. Here in the glabella, the 11s, the forehead, those wrinkles in the forehead, and then also the crow's feet, which is those lines when we smile. It's commonly used in places like the jaw, the mandible, for even TMJ, for example.
Oh, really? Wow.
For clenching and TMJ, for creating a little bit more angulation of the jawline as well, and kind of more slender jawline. But then if you're getting around the muscles of the face, that can be done there in small amounts, but you just have to exercise extreme caution just so you don't end up paralyzing one of those muscles.
Now, is this something that's solely in use for women, or do men use Botox as well?
Very common, both men and women.
Really?
Yeah, men and women, almost in exact equal numbers.
As well?
For wrinkles as well. It's probably a bit more popular with women, but we have a ton of male patients as well.
Wow. Well, you've been listening to Dr. Chris Plaman from Precision Medical Hair Restoration. Do we have any questions?
We do have a couple of questions.
All right.
So, first question, what made you interested in becoming a doctor and specializing in this field?
So I kind of stumbled on the field of hair restoration just by chance. Wasn't even on my radar originally. Went to medical school at UNM, so there wasn't really any place that I had exposure to here locally. I wasn't exposed to it really till I came out to California. I saw how much you could change someone's life in a day. Really, it's something that a lot of patients are concerned about. It's something that is really, I can't think of a medical condition that humans experience that's more common. More than 80% of men, more than 50% of women will experience hair loss in their lifetime. So most common medical condition there is, and yet most people have no idea where they can go for any type of support in this area. And a lot of those patients, it's really affecting them in a negative way internally. And so just being able to kind of give more power and control back to that individual, there are tools, there are resources, there are things that we can do to slow down the hair loss into the future, to get back more of what's lost, and to optimize what you have.
Nice. I'm sure it's a huge confidence builder.
Absolutely. So there's actually been a lot of studies that have shown that not only has it improved patients' work performance, it's improved social performance. A lot of patients will take care of themselves better. It might renew their enthusiasm for, maintaining a good nutrition program, getting back to diet and exercising. And so it tends to spin things in a positive spiral for people. And it's been pretty inspiring and very impactful to be able to participate on that journey with a lot of our patients.
Absolutely. Next question. Who would be your typical patient? Is there a difference that you're seeing in age or gender or ethnicity?
Yeah, it's a great question. So there isn't anyone who I would say is spared from hair loss, right? It can affect anybody. And sometimes it can be even patients who both of their parents have a full set of hair. They have hair loss at a pretty aggressive pattern at an early age, and they're scratching their head like, what's going on? So, and a lot of times it can be a mixed assortment of genes that we inherit. There can be environmental factors. There can be other medical things going on. So it's really all walks of life. We see patients as early in their teen years. A lot of times hair loss can start anytime, even during puberty with the changing and fluctuation of the hormones. Wow. So it's pretty common. We'll see early teenagers all the way, every pretty much decade onwards. I've had patients who have been 94 years old actually getting wheeled into the office from a nursing home, had a lot of other things going on, heart failure, you name it. But really what bothered them the most was the hair loss. And so I don't think it's anything that it's interesting. It's something that really sticks with people sometimes for a long time as part of identity. So we see all different age groups, all backgrounds.
Awesome. What would you say the time frame is for somebody who's just walking into your office to seeing some results?
That's an excellent question, and I appreciate you asking that, because it's really important to have realistic expectations, right? So for a lot of patients, hair loss is something that's, it's a chronic progressive condition. This is something that's been going on for a while, and maybe if we haven't addressed it right away, right? It's not the same as getting a toothache where it hurts you go into the dentist that week, right? So this sometimes has been more of a slower, gradual process to occur. And then a lot of times the reverse of that is also true, right? It's important to have realistic expectations and know that good things take time, and kind of have a realistic time frame of what to expect. So for a lot of times, for example, when we have a comprehensive medical strategy, most patients aren't going to see any type of benefit for the first couple months. A pretty decent cohort is starting to notice that we're starting to see some improvements by the 4 to 6 month range, and sometimes it can even take a little bit longer. So, when we're first starting off, it kind of feels like it's like watching paint dry at times. For a hair transplant, it's going to be another slower process. So it's important before considering a transplant to have a very good idea of the typical timeline for healing and then the benefit from the procedure. So the first month, there's quite a bit of healing that takes place. So we're kind of taking a step negative in the wrong direction aesthetically. Then we kind of get back to kind of a period of being back to more or less neutral, back to where we started. The hair that was transplanted will shed, but the native hair tends to grow. Usually those transplanted hairs start sprouting at about the 3 to 4 month mark, and we'll get at least about half of the benefit between 5 to 6 months. That's usually the time frame where patients are thinking, okay, I'm glad I got this hair transplant. This was a good idea. I can see it's going to turn into something good. And then it just gets better with time. It can take 10 months to even 16 months to get the full result.
Awesome. Last question. How do you think environmental factors play into hair loss, like diet and lack of exercise?
All of those are hugely important. Number one thing for me, a constant theme that we see in hair restoration is that blood flow is critically important for growth of hair follicles. And hair follicles are very metabolically active. How much blood flow, oxygen, nutrients are being delivered is really going to dictate how successful we are with our hair growth, right? The things environmental factors that I think are the some of the most detrimental, for example, smoking is, and even nicotine, vaping, those types of things, those can all play a role by compromising the blood flow and the peripheral capillaries to those hair follicles. Same thing with dieting and exercise, right? If you're exercising, that's also going to be improving your blood flow, right? And that's going to be helpful for patients as well. But all these things kind of play a role and are, kind of contributing to this big context of kind of what's driving the hair loss.
So, I think my biggest question right now is that these are all sensitive subjects. They tie into ego, they tie into, confidence, things like that. What advice do you have if someone is contemplating these things? What's that first step that they should take?
You're exactly right. For a lot of patients, it's something that's been bothering them for a long time. Mm-hmm. Not sure who to go to, where to go, if anything actually even works, right? Mm-hmm. I think the first step is just to reach out and to try and get more information. The information is an important aspect so you can make an informed decision and see if something sounds like it might be helpful for you, but you have to get some data and some information to kind of get some expectations to know how something might be helpful for you. But we've had a lot of success with patients in all different stages of hair loss. But I think having a realistic discussion and understanding of what potential benefits are would be the first place.
So you have a website, I take it. I think I redesigned it.
Yeah, thank you for your help with that.
So let the listeners know what your website URL is so they can
Sure.
get that information.
Yeah, so it's at precisionmedicalhair.com.
All right. And then you're located again on San Mateo.
San Mateo, yep, 5111 San Mateo Boulevard.
And what's your phone number?
505-557-5500.
All right. Is there anything else you want to share with our listeners today?
No, that was pretty much it. Thank you guys for the excellent questions, chiming in.
All right.
But yeah, looking forward to helping anybody who has any concerns with either hair loss, medical management of their weight, any way we can help them.
I think in the next couple days, you're going to make an appearance on TV as well.
Yeah, so if you want more information, we'll be tuning in. I think, what is it?
KRQE
on Friday morning. We'll be having another segment.
Yeah, great. All right. Well, that concludes this episode of Lights, Camera, Clicks with Dr. Plaman. And thank you all for listening today.